You're listening to Businesstalk podcast. I'm your host Deepak from India. We are honored to welcome Dr. Ying Lin, Associate Professor in the Department of Industrial and Systems Engineering at the Cullen College of Engineering, University of Houston, as our distinguished guest on today's podcast. Dr. Ying Li is also affiliated with the Human Centered Artificial Intelligence Institute as one of its distinguished faculty members. Dr. Lin earned her PhD in Industrial and Systems Engineering from the University of Washington. She also holds an MSc in Industrial and Management Systems Engineering from the University of South Florida and BS in Statistics from the University of Science and Technology of China. Her research group explores the intersection of data analytics, quality engineering, and healthcare. Their work focuses on several key areas: statistical learning and data mining for biomedical and sensing data analysis, quality engineering, including system modeling, prognosis, and prognosis-based monitoring, and medical decision making with a special emphasis on personalized medicine, disease prevention, and monitoring. Dr. Lin's contribution to the field have been recognized through numerous awards. She was a finalist in the student paper competition in quality control and reliability engineering at the Institute of Industrial and System Engineering annual conference in Pittsburgh in 2017. She received a prestigious Lee B. Lusted Research Prize at the Society for Medical Decision Making annual conference in Vancouver in 2016. Additionally, she earned a student travel scholarship to attend SIAM Data Mining Conference in Vancouver. Earlier in her academic career, she was honored with the Outstanding Student Scholarship in 2011 and the Alumni Foundation Excellent Student Award in 2008, both from USTC. In this episode, Dr. Ying Lin shares valuable insights from her research, the future of medical decisions, data-driven approaches to precision medicine. So without further delay, let's welcome Dr. Ying Lin to the podcast. Dr. Lin, thank you for graciously accepting our invitation. It's an honor and privilege to have you with us today.
Thanks, Dr. Hart, for the nice introduction and the invitation to this business talk. It's my great honor to join.
Thank you. Dr. Ying, how is precision medicine reshaping the landscape of medical decision making today?
That's a great question. So I think to answer this question, probably we need to know what is the traditional medical decision-making process. So traditional medical decision-making process rely on we call the one-size-fits-all monitoring decision guidelines. And it operates on the principle that if a treatment works for a statistical significant majority of a large cohort, then it can be applied to the general population. This approach mainly focuses on the symptoms and the classification of disease, not the biological uniqueness of the individual patient. So, however, this biological uniqueness of each individual may lead to the various effectiveness of treatment from individual to individual, even they are diagnosed with the same disease. Therefore, this one-size-fits-all guidelines may be ineffective over a certain portion of the individuals. Then a precision medicine is developed to solve this issue. So instead of basing decisions solely on population averages, and the generalized clinical guidelines, precision medicine use this genetic, molecular, and the lifestyle and other environmental information to tailor the prevention, diagnosis, and the treatment of disease to the individuals. And there are many types of disease that have been seen the successful application of precision medicine. One example I would like to point is the precision oncology. It is at the forefront of this transformation. Historically, the cancers were classified and treated based on the tissue or origin, like a breast cancer, a lung cancer. And today, the decision-making process has shifted to identifying the molecular fingerprints of tumor, enabling our treatment to be chosen based on the DNA signal of the cancer itself. And this new approach has yielded remarkable clinical outcomes. For example, I think the breast cancer is one successful application of it.
Professor, could you explain how advanced data analytics and machine learning models contribute to individualized treatment plans?
That's also a good question. So, as we know, precision medicine or individualized treatment plans, we need to make a treatment tailored to each individual based on the individual's genetic, molecular, clinical factors. And this actually requires the advanced data analytics and the machine learning models there. It is a central part of implementing the precision medicine. And fundamentally, it changed how individual treatment are created by analyzing the large amount of data into the actionable insight. This technology actually process the complex disease-related data sets, such as the genetics, tissue database, electronic health record, and they can make the predictions or discover the actionable insights from the data. Specifically, they uncovered the interactions among a large number of risk factors on the individuals, and they can group the individuals into more homogeneous subgroups based on the risk factors and make the accurate predictions for the treatment effectiveness. And based on this treatment effectiveness, the machine learning model predict, we can determine or select what would be the best treatment decisions for each individual. And we have
Please go ahead.
Thank you. And we have conducted several projects that use machine learning models for this precision medicine or individualized treatment plans. For example, in our previous study on the depression medication, which is antidepressant medication applied to the major depression disorder patients, we found that patients under this treatment will have different effectiveness, which lead to different depression trajectories. Some patients, their depression will be released by the treatment. They react where they present the healthy or less severe depression condition. But some patients under the treatment, their depression actually goes worse. So that informs us for those patients, they may not be better, they may need switch to other more effective treatment.
What types of medical data are most critical for building effective predictive models in precision medicine?
Thank you. I think for this question, we have to answer it from several different types of data need to be integrated together. So precision medicine or the medical decision-making problem usually is a very complex problem that involves from the micro level, like biological data, to the macro level, like environmental and social data. So first, the type of data that is important includes the genomic and omics data. And this is a foundational pillar for precision medicine. It includes the individual's unique DNA sequence, as well as this multi-omics data, such as genomics, transcriptomics, proteomics, and metabolomics. And analyzing these data layers help predict how a person's body reacts, function, and their susceptibility to certain disease, and how they will respond to the different medication or treatment from the biological process. And the second type of data is very important is what we actually usually see in clinical practice is clinical and medical data. And this type of data, we usually call them electronic health record or electronic medical record. And the predictive models rely heavily on this information to predict the disease onset on certain individual, how the disease and the treatment outcome will look like for the individual. And the third type of data I think is very important is the lifestyle and the behavior data, which include the individual's lifestyle and environment factors. And this information is helpful because a lot of disease, especially the chronic disease, their development are closely related to the lifestyle and the behavior of the patients. And the last one is also important is the environmental and the social data. Environment in which a person lives, including the air quality, social factor, and community resource, can significantly influence the health outcome.
Dr. Lin, how do real-time risk assessment work in clinical settings, and what role does machine learning play in this?
That's a great question. So for the real-time risk assessments, it's different with a traditional static health risk assessment. Real-time risk assessments are dynamic, and it's a continuous process that leverage a patient's changing health conditions and other time-varying risk factors to predict the dynamic changes in the risk of disease. Basically, assume that the patient's health condition is not static, it changes over time. So we need to real-time update and predict the risk. While the static health risk assessments rely on those time invariant risk factors, such as genetics, demographics, which are not changing over time. And the real-time risk assessment are better fit for the disease that are chronic, and they can provide an adaptive, continuous view of patient's condition. Machine learning models play a central role in this real-time risk assessment because in real-time risk assessment, we are facing with more complex data set that include the sequential observations of the patients. Therefore, the machine learning model is critical to capture this autocorrelation in the sequential observations, as well as these interactions among the multiple factors to make the prediction. A machine learning model also enable the fast and efficient prediction in real time to inform the timely decision making.
Professor, could you share some examples where data-driven approaches have significantly improved patient outcomes?
Yeah, sure. First example I can think of is in the genetics. So this a lot of data-driven approaches have been developed in bioinformatics to analyze the large cohort of genetic data and identify the genes or the mutations, genetic factors associated with a particular disease. And this type of analysis is very helpful for the proactive risk assessment. By using the genomic testing of an individual, it can reveal an individual's risk for future disease. Then physicians can help patients make a lifestyle change or seek preventive treatment. A well-known example is in the breast cancer, the use of BRCA1 and the BRCA2, these two gene mutation testing, has been successfully used to guide or inform the woman's decision to undergo a preventive mastectomy to lower their risk of breast cancer. And other examples include the use of machine learning or data-driven approaches to predict the sepsis. Sepsis is a very common adverse events in ICU, and predict the sepsis in advance is very helpful to conduct the preventive care or the early intervention. And I know there are many hospitals like Johns Hopkins, like UCSF, they have successfully developed the sepsis prediction and implement this model and modules in their system.
Very insightful. Professor, how do you address the challenges of data quality and privacy when applying machine learning in healthcare?
Thank you. This is a very important question. Actually, during our analysis of healthcare data, we actually face a lot of issues of data quality and privacy. So first, the data quality challenges include missing values in the data. The data are observed under irregular observation time, and the data are noisy. Some data, they actually have higher noise because of like a human error collection methods, like a self-report questionnaire data. And also, the healthcare data has the issue of imbalanced data, which means the disease occurrence or onset is usually a real event. Then we will see the patients that with disease, the number of patients with disease is much less than the normal patients. And different issue or challenge, I think they need a specific machine learning techniques to deal with. For example, for the missing value, we have different missing value imputation methods, such as the k-nearness-neighbor imputation, multiple imputation by chained equations, and so on. And for the imbalanced data issue, also it can be addressed by the several resampling algorithms, such as the upsampling, downsampling, and the SMOD. And recently, we also developed an advanced SMOD method to better address the imbalanced data issue.
In what ways can predictive modeling help clinicians make faster and more accurate decisions during emergencies?
The ability to make rapid and accurate decisions is critical in the emergencies. And the predictive modeling is as a methodology that leveraging the statistical algorithms to automatically analyze the data and quickly make the prediction actually has the capability to transform the force in this domain. By analyzing this large amount of data, either historical or real-time data, these models can provide clinicians with timely, patient-specific insights that enhance the diagnostic accuracy and optimize the operation efficiency. There are two emergency cases or situation I can think of. First one is in the emergency department. Predictive models have been used to transform the initial patient assessment process in the emergency department by introducing the dynamic data-driven triage. Upon the patient's arrival, these models can analyze the historical data on the patient presentations, outcomes, and the treatment times, and also the patient's historical information in the hospital to identify or prioritize who should require the immediate attention in the emergency department. So the patient prioritization is very important. And the second example I can think of about the emergency cases is in the ICU. As I mentioned previously, in the ICU, there are a lot of adverse events like sepsis, the cardiac arrest. And this kind of adverse events, if they can be predicted earlier and early intervention is implemented, then they can be prevented and improve the ICU patients' health outcome. And predictive modeling actually is a very important technique in this area.
Dr. Ying, how do you see the integration of wearable and sensor data influencing future medical decisions?
Thank you about this question. I think the wearable and the sensor data is an important component to shift the model of healthcare to from reactive to proactive because they focus on the continuous remote patient monitoring. The continuous stream of this type of data, which include like lifestyle, behavioral information, vital signs, physical activity, sleep pattern, a lot of information in our daily life can be captured. And this provide a holistic view of the patient's health that was previously unavailable outside of a clinical setting. And the predictive analysis and AI can analyze this information to detect the anomalies and the patterns that may signal a health issue before it becomes critical, enabling early intervention and potentially preventing emergencies. And these wearable data are usually used to manage the chronic conditions like cardiovascular disorders, diabetes, and respiratory illness. For instance, the continuous glucose monitor provides the real-time feedback to help manage the diabetes.
What role does interpretability of machine learning models play in gaining trust from medical professionals?
That's an excellent question. The interpretability is a critical component in data-driven decision making, especially for the healthcare. Without a clear understanding of how a model arrives a particular recommendation, clinicians are unlikely to act on its output, particularly in the high-stakes environment, like the emergency department where patient outcome hang in the balance. This is often referred to as the black box problem, where the algorithms, machine learning, particular machine learning algorithms, were criticized as black box. And there are several reasons and motivations why clinicians they need interpretability. First is the rationale and confidence. The clinicians are more likely to trust and use a tool when they understand the rationale behind its predictions. This transparency allows them to validate the model's logic against their own clinical expertise and the patient's unique circumstance. When a model can explain why a patient is at high risk, then it enables a doctor to create a more tailored and specific medical plan. The second important reason is it prevents over-reliance. A transparent model is less likely to lead to over-reliance of this automation, and which is a major human factor risk in healthcare. Over-reliance can lead to the errors, especially among less experienced clinicians. By providing the explanation, this machine learning tool, rather than replace the human judgment, they reinforce that they are a decision support aid and not a definitive diagnosis. And the last one is about the validation and the accountability. So when we interpret a model is also another way to validate whether our model works correctly or not based on the human expert's knowledge. And this is especially important for the complex models, where the lack of a clear rationale makes it difficult to assess their validity. And the ability to audit a model's decisions is crucial aspect of the responsible implementation. And to push or enhance the interpretability of the machine learning model, we have the explainable AI recently to a lot of techniques in this area to address this challenge directly.
Professor, my last question. Looking ahead, what are the biggest opportunities and potential risks of relying more heavily on data-driven methods in precision medicine?
Thank you. This very nice question. I will do my best to try to summarize it. So the first thing, I think the potential opportunities or the biggest opportunities is data-driven models, as I mentioned before, accelerates the development of precision medicine. They help to quickly and timely provide the actionable insights based on the larger amount of real-world data on the individuals. And this accelerates the personalized care. And potentially it could help improve our health outcome by identifying more effective treatment plan and the quality of healthcare service, which can tailor our healthcare resources to the ones who really need them. And the potential risk of these data-driven methods, actually, there are several potential risks, I think. First one is this algorithmic bias and health inequities. So this actually comes from the data we used for training our model. If the algorithm or the models, they are trained on historical data that reflects societal inequities. For example, we know that in a model for healthcare spending underestimates the need of a certain population because they have historically received less care. There is an example in the breast cancer screening. We know in the breast cancer screening currently in our healthcare system, the rate of breast cancer screening is pretty low for the African American. And this low screening rate may lead to our data set does not include enough information about the African American group. Then these algorithms that trained or built based on historical data may have certain algorithmic bias. And the second issue I can see is in data privacy and security. Data privacy and security is always an issue when we use these algorithms, we collect the data, computerize it, and analyze it. And to better protect the data privacy and security could be a very important topic for the data-driven method. And also, lack of transparency, accountability is an important risk we need to solve. But I think we are already towards the way to pay enough attention to it and solve or try to solve it.
Thank you, Dr. Ying Lin, for sharing your expertise and shedding light on how data-driven approaches are shaping the future of medical decisions. Your insights into precision medicine and advanced analytics highlights the incredible potential of technology to improve patient care and outcomes. We look forward to seeing how these innovations continue to transform healthcare. Thank you to our listeners for joining us. Stay curious and stay healthy. Thank you once again, Dr. Ying Lin, for sharing your research insights with us. We truly appreciate your time and commitment.
Thank you.